The nurse leaned close to my hospital bed, her breath warm against my ear. "Mrs. Lockhart, if you can hear me, don't let them take you to surgery tomorrow. Something is very wrong." Then she was gone, her footsteps quick and quiet down the hallway. My eyes were closed, my body still. But my mind was racing. I'm Esme Lockhart, 61 years old, and I'd checked into Mercy General Hospital 3 days ago for what should have been a routine gallbladder removal. Now, a nurse I'd never met was warning me about my own surgery. My heart pounded against my ribs, but I kept my breathing steady and slow. I needed to understand what was happening, and I had a terrible feeling that pretending to sleep was about to save my life. Let me explain how I ended up here. 2 months ago, I started having terrible pain in my upper abdomen. Sharp, burning pain that made me double over. My family doctor, Dr. Waverly Chen, ran tests and found gallstones. She recommended removal, said it was a common procedure. Nothing to worry about. My husband Carver was nervous. But I told him thousands of people had this surgery every year. I'd be fine. Dr. Chen referred me to Dr. Hollis Drummond, a surgeon at Mercy General with an excellent reputation. I met him once before the surgery. He was polished, confident, with perfect teeth and expensive shoes. He explained the procedure in medical terms I barely understood. Assured me I'd be home in 2 days. I trusted him completely. That was my first mistake. I checked into the hospital on Monday morning. The plan was simple: surgery Tuesday afternoon, recovery overnight, home by Wednesday. Carver had taken the week off work to take care of me. Our daughter Sloane was driving in from Portland. Everything seemed routine. The nurses were friendly. The room was clean. The food was terrible but expected. On Monday evening, a different nurse came in to prep me for surgery. She took my blood pressure, checked my vitals, asked standard questions, but there was something in her eyes when she looked at my chart. A flicker of concern she quickly hid. I asked if everything was okay. She smiled professionally and said everything looked perfect, but her hands had trembled slightly when she hung the chart back on the door. Tuesday morning arrived. I was supposed to have surgery at 2 in the afternoon. They'd told me not to eat or drink anything after midnight. By noon, I was hungry and anxious. Carver sat beside my bed, holding my hand, making jokes to calm my nerves. Dr. Drummond stopped by around 1 o'clock. He seemed rushed, distracted. He asked a few quick questions, barely listened to my answers, and left within 3 minutes. Something about his visit felt off, but I couldn't pinpoint what. At 1:30, a nurse came to give me pre-surgery medication. She inserted an IV and started a drip. Within minutes, I felt drowsy. Carver's face became fuzzy. I heard him say he loved me. And then everything went soft and distant. I was floating somewhere between awake and asleep when I heard the whisper. "Mrs. Lockhart, if you can hear me, don't let them take you to surgery tomorrow. Something is very wrong." The voice was urgent. Frightened, I tried to open my eyes, but my body wouldn't respond. The medication had paralyzed my muscles while leaving my mind partially alert. I heard footsteps retreating, then other voices in the hallway. Someone said my name, someone else mentioned Dr. Drummond. I fought against the fog in my brain, trying to make sense of what I'd heard. Why would a nurse warn me about my own surgery? What could possibly be wrong? I heard more footsteps entering my room. "She's ready for transport," a male voice said. "Surgery's been moved up to 3 o'clock. Moved up? Why would they change the time without telling me or Carver? I felt hands on my bed, preparing to wheel me somewhere. Then I heard my husband's voice, sharp with confusion. "Wait, what's happening? The surgery isn't until 2. The male voice responded smoothly. Dr. Drummond had an opening in his schedule. "We're taking her now to prep." Carver sounded uncertain. "But shouldn't someone have told us?" "Can I come with her?" There was a pause. "Family members wait in the surgical waiting area on the 3rd floor. Someone will update you there." I wanted to scream, to tell Carver something was wrong, but I couldn't move or speak. The medication had me trapped inside my own body. I felt the bed start to move, rolling down the hallway. Everything in me was screaming that this wasn't right. That nurse's warning echoed in my mind. "Don't let them take you to surgery." But I couldn't stop anything. I was being wheeled through corridors, listening to sounds I couldn't see. Elevator doors opening, wheels rolling over different flooring, voices discussing something in low tones. Then suddenly, the movement stopped. I heard a woman's voice, firm and authoritative. "Where are you taking this patient?" The male voice from before responded. Mrs. Lockhart, scheduled for cholecystectomy with Dr. Drummond. The woman's voice grew sharper. This patient's surgery was scheduled for 2 o'clock in OR4. Why is she being moved at 3 to OR7? There was a tense silence. Dr. Drummond requested the change. The man finally said. The woman didn't respond immediately. Then she said, return her to her room. I need to verify this with Dr. Drummond directly. I felt the bed turn around, heading back the way we'd come. Back in my room, I heard Carver's relieved voice. What happened? They said there was a scheduling issue. Someone, maybe the woman who'd stopped my transport, said they were confirming details and would be back shortly. Then I was alone with Carver, still unable to move or speak, trapped in my medicated body. Time passed strangely. I couldn't tell if minutes or hours went by. The medication began to wear off gradually. Sensation returned to my fingers first, then my toes. I could feel the scratchy hospital blanket, the IV tube in my arm. I kept my eyes closed and my breathing steady, instinctively understanding that I needed to stay still and listen. That's when I heard voices outside my door. Dr. Drummond's voice, irritated. Why was my patient sent back to her room? The woman's voice responded calmly. Because her surgery wasn't scheduled for OR7, and I wanted to verify the change with you personally. Dr. Drummond's tone became condescending. I'm the surgeon. I can change operating rooms if I need to. OR7 has better equipment for this procedure. The woman didn't back down. OR7 is used for experimental procedures. A routine gallbladder removal doesn't require that room. There was a long, tense pause. Are you questioning my medical judgment? Dr. Drummond asked, his voice dangerously quiet. I'm following hospital protocol. The woman replied. Any use of OR7 requires administrator approval and patient consent forms. I don't see either in Mrs. Lockhart's file. Dr. Drummond made an angry sound. This is ridiculous. I'll speak to Bran about this. His footsteps stormed away down the hallway. The woman entered my room quietly. I sensed her standing beside my bed, studying me. Then she spoke softly. Mrs. Lockhart, I know you're waking up. When you can, I need you to open your eyes. I managed to flutter my eyelids. She came into focus slowly. She was young, maybe 30, with dark hair pulled back and an ID badge that read, Nadia Kumar. RN, she was the one who'd stopped them from taking me. Can you hear me? She asked. I managed a small nod. Nadia glanced at the door. Then back to me. I need you to listen carefully. Something is happening in this hospital that isn't right. Dr. Drummond has been taking patients to OR7 for what he claims are routine procedures. But those procedures are taking much longer than they should. And the patients are coming out different. Different, the word sent ice through my veins. I tried to speak, but my mouth was dry and clumsy. Nadia held a cup of water to my lips. Let me take small sips. What do you mean? Different, I finally managed to whisper. Nadia's face was tight with fear and anger. Memory problems, confusion, personality changes. One woman forgot her own daughter's name. A man came in for hernia repair and left unable to do simple math. Their families think it's complications from anesthesia. But it's been weeks and they're not improving. My mind reeled. What is he doing to them? Nadia shook her head. I don't know exactly. But OR7 isn't a normal operating room. It's part of a research wing. And there are rumors about experimental procedures being conducted without proper oversight. Why hasn't anyone reported this? I asked, my voice getting stronger as the medication wore off. Nadia looked away. Some of us have tried. But Dr. Drummond has powerful friends on the hospital board. 2 nurses who raised concerns were fired for unrelated violations that appeared in their files. Another was transferred to night shift in a different wing. People are scared. She looked back at me, her eyes pleading, but I can't stay quiet anymore. You're the 5th patient this month scheduled for OR7. I had to warn you. I felt sick. Why me? Why would he target me? Nadia pulled out her phone and showed me something. Does the name Whitmore Pharmaceuticals mean anything to you? I stared at the screen. Whitmore Pharmaceuticals was the company my husband Carver had sued 3 years ago. Carver worked as a safety inspector for a state regulatory agency. 3 years ago, he'd uncovered evidence that Whitmore Pharmaceuticals was falsifying drug trial data. His testimony helped shut down one of their most profitable research programs and resulted in massive fines. The company had fought back viciously, trying to destroy his credibility. But the evidence was too strong. They lost. I looked at Nadia in horror. What does Whitmore have to do with this? She showed me another document on her phone. Dr. Drummond received a research grant last year from Whitmore Pharmaceuticals, $2 million to study neurological responses to experimental compounds. The grant is contingent on successful human trials. The pieces clicked together with terrible clarity. He's using patients as test subjects, I whispered, and he chose me because of Carver. This is revenge. Nadia nodded grimly. I think so. When I saw your husband's name on your admission forms, I looked him up. The connection to Whitmore was too obvious to ignore. I felt rage building through my fear. We need to call the police, the medical board. Nadia gripped my arm. We need evidence first. If we go to authorities now, Dr. Drummond will destroy everything and disappear. The hospital will claim ignorance. We need proof of what's happening in OR7. I understood what she was asking. You want me to go through with the surgery? Nadia shook her head quickly. No, absolutely not, but I want you to stay here. Pretend you're still too sedated to leave. And help me document what's happening. Your surgery was postponed because I flagged it. You're safe for now, but there's another patient scheduled for tomorrow. Before I could respond, footsteps approached rapidly. Nadia moved away from my bed, just as Dr. Drummond entered with a man in an expensive suit. The man's badge identified him as Mr. Brandt, hospital administrator. Dr. Drummond's face was cold as he looked at me. Mrs. Lockhart, I apologize for the confusion earlier. Unfortunately, we've discovered some abnormalities in your pre-surgical blood work that require additional testing. We'll need to postpone your procedure for 24 hours. It was a lie, my blood work had been perfect. But I understood the game. He was delaying because Nadia had disrupted his plan. He needed time to reorganize, to get me back under his control without interference. I let my eyes flutter closed again, pretending the medication still had me groggy. Okay, I mumbled. Whatever you think is best, doctor. After they left, I waited 5 minutes before opening my eyes. Carver was standing at the window. Looking worried, I spoke quietly. Carver, I need you to listen very carefully and not react. His head turned sharply toward me. I could see him fighting the urge to rush over. I told him everything, the warning, the conversation with Nadia, the connection to Whitmore Pharmaceuticals. I watched my husband's face cycle through disbelief, horror and cold fury. When I finished, he was silent for a long moment. Then he said, "We're leaving. Right now, I'm taking you out of this hospital." I shook my head. If we run, he'll just choose another victim. We need to stop him. Carver's jaw clenched. Esme, this is not your fight. These people tried to experiment on you. His voice cracked. I can't lose you. You won't, I said firmly. But we have to do this right. Nadia said we need evidence. Call Sloan. Tell her to bring her laptop and camera equipment. She's a journalist. She'll know how to document this properly. Carver looked torn. Finally, he nodded and pulled out his phone. While he called our daughter, I thought about the other patients. The woman who forgot her daughter's name. The man who couldn't do math anymore. Lives destroyed for pharmaceutical profit and petty revenge. I'd spent 30 years as a social worker protecting vulnerable people. I wasn't going to stop now just because I'd become the target. Nadia returned an hour later with another nurse. An older woman named Grace. We have access to OR7 maintenance logs. Grace said quietly. There are chemical compounds being used there that aren't approved for any known surgical procedure. Sloan arrived that evening. Her journalist instincts immediately activated when Carver explained the situation. She'd brought recording equipment, her laptop, and a contact at the FBI who specialized in medical fraud. Mom, this is bigger than just you, she said, setting up her equipment. If they're running unauthorized human experiments, this is a federal crime. We worked through the night. Nadia and Grace provided documents. Sloan recorded video statements. I wrote down every detail I could remember. By morning, we had enough evidence to contact Agent Cordelia Vance from the FBI. She arrived within 3 hours, accompanied by 2 other agents. I watched from my hospital bed as they met with Nadia, reviewed our evidence, and made phone calls. Agent Vance came to my room finally, her expression serious but satisfied. Mrs. Lockhart, you've helped us build a case we've been investigating for 6 months. Agent Vance explained that the FBI had been tracking Whitmore Pharmaceuticals' illegal activities for over a year. They'd suspected Dr. Drummond was conducting unauthorized experiments, but couldn't get inside evidence. Our documentation gave them what they needed. That afternoon, federal agents raided OR7 and Dr. Drummond's office. They found detailed records of unauthorized procedures on 43 patients over 18 months. Every patient had some connection to people who'd caused problems for Whitmore Pharmaceuticals. It was systematic revenge disguised as medical care. Dr. Drummond was arrested along with 3 hospital administrators who'd been covering for him. The evidence against them was overwhelming. I watched it unfold on the hospital television. Carver holding my hand, Sloan recording everything. "You did it, Mom," Sloan said quietly. "You stopped them." But I thought about the 43 people whose lives had been destroyed before we could act. I was discharged 2 days later without having my surgery. Dr. Chen arranged for the procedure at a different hospital the following month. It went perfectly. Dr. Drummond was sentenced to 25 years in federal prison for medical fraud, assault, and conspiracy. Whitmore Pharmaceuticals paid over $300 million in fines and settlements. Nadia and Grace were recognized for their courage in exposing the conspiracy. But the 43 victims still struggle with the damage done to their brains. Some have recovered partially. Others never will. I think about them often. About how close I came to being number 44. I'm 62 now, and I've learned something important. When someone warns you that something is wrong, listen, even if it sounds impossible. Even if it disrupts your plans. Listen, that nurse's whisper saved my life. And pretending to sleep while gathering evidence saved countless others. Sometimes the bravest thing you can do is stay still. Stay quiet and pay attention to what people think you can't hear. If this story made you think twice about trusting medical situations blindly, please subscribe and comment where you're watching from. Always ask questions about your medical care. Always get second opinions. And if something feels wrong, it probably is. Your instincts exist to protect you. Thank you for listening. Always question unusual medical procedures. Request copies of all consent forms. Research your doctors if something feels wrong. Get a second opinion immediately. Patient advocacy can save lives. Before you go, I need to know something. What hit you the hardest? The betrayal. The moment everything fell apart. The twist you never saw coming. Drop it in the comments right now. And tell me what you want to see next. Medical fraud, family secrets, financial crimes, hidden identities. Your ideas become our next stories. If this story kept you glued to the screen, hit that like button. If you want more shocking true stories that expose the truth, subscribe and turn on notifications so you never miss what's coming next. Thanks for letting me share this story with you. The next one drops soon, and it's going to shake you even harder. See you there.